Uh-oh, guess what day it is? Guess what day it is? Huh? Mike, what day is it, Mike?
Hello, I'm Michael Andrew Weston, and welcome back to Hump Health Talks. I am so excited once again to have probably the best person in our organization. Now I'm going to say it every single time, Miss Mary. She leads our behavioral health department, and this month is Mental Health Awareness Month. And we're going to be spending this month talking about some crucial and critical issues that surround mental health. And today we're covering a topic that I think is just so important, and that is the topic of loneliness. Let's just talk about the effects of loneliness on mental health.
Okay. I think it's really important for us to talk about the epidemic that this country is feeling right now, experiencing because of loneliness. And what it does is it forces you to believe that you don't have any value, you're not connected, you're not able to focus because you can't figure out where you fit in. It was exacerbated with COVID when we were forced into isolation. So anyone who was struggling with even basic social interactions found themselves with no one to interact with. And so that has just gone on and on. And as a result, people, I think the statistic I read recently said 1 in 3 Americans finds themselves feeling lonely. And it doesn't matter how many people they're in a room with. And that's the problem with loneliness. People think that if you're surrounded by people, you can't be lonely. But if you don't feel connected, if you don't have a sense of value, you can't identify anyone you believe cares about you, then loneliness takes them. And people often fill that void with pets. You know, they'll get a dog, they'll get a cat, a bird, a snake. Don't understand snake, but a bird or
Well, I can understand a snake. I think it's pretty cool.
oh, really?
My brother has alligator.
An alligator.
Yeah.
Alrighty then. But if that makes them feel connected, then why not? Then why not? You feel like, what is the purpose for me? And as a result of that, we experience suicidality. We find ourselves in a terrible mood. Often people are really, really grumpy.
As you know, I recently experienced the loss of my family, and it has put me in a space where I have to be very mindful and conscientious and intentional about reaching out to people and connecting with people, not just for the sake of me feeling lonely or me feeling hurt, but also it gives you a broader, when you're very in tune with who you are and what you're dealing with, it gives you a broader sense of what people are dealing with.
Absolutely. And it's kind of interesting in this work that I do. I talk all day. I talk all day, whether I want to or not. And I have to consciously reach out to people as well. Because I have my phone ring. Caller ID is a blessing and a curse. Because I can say, no. But
See, and I say that I don't just need caller ID, I need caller intention.
caller intention.
Now, who's calling, but why are you calling?
Why are you calling? Well, sometimes too, the way we recharge our batteries, interestingly enough, is by forcing yourself to take that extra step. The other thing is that chosen loneliness is self protection because not only is it ego based, but it's also, you can't hurt me if I don't let you in. And so forcing ourselves into that level of isolation is more painful than having someone say, I can't talk to you now, or why do you keep calling me? Because you don't feel connected. And if you've ever met people who are really at that lowest point of loneliness, they'll say, nobody cares about me. Nobody sees me. Nobody hears me. So what's the point? What's the point? And so the point is we need to connect to live. That's the point.
Yeah,
That's the point.
we need to connect to it.
To live. Absolutely.
That's a big statement. I really want to thank you for sharing always your heart, always sharing your expertise. And thank you all so much for joining in for another Hump Day Health Talk. And I will see you next time.
All right.